Good morning. Welcome, everybody. Welcome to our commissioners, to our health commissioners. It is 10:31, and we are in room 1010. We don't have a quorum. We had a quorum, but one of my colleagues had to cancel at the last minute for some other urgent notice. But irrespective, we could still take all the reports, and I could send it over to council as the chair's report. Anyone who wants to make a public comment, please fill out a public comment card. And there are no public comment cards. So we will close public comment, and we'll move directly to agenda item number 1. Mr. CLA.
Item number 1 is a presentation by the Los Angeles City Health Commission relative to the 2015-16 annual report with recommendations and a strategic plan of action for addressing the most significant health issues in the city.
Thank you. And we are joined by President of our commission, Susie Shannon, and also Commissioner
Ron Cato.
Yes, Ron. Great report, very robust report. And why don't we just get right into it?
Great. Thank you so much, and thank you to the Commission for inviting us to present this report. This is our 2015-2016 report, and it's actually the first annual report that our Commission has created, so I'm very proud of everyone who has worked on it and happy to present this to you. So I'm first going to start off by saying that the report was compiled with research and writing assistance from California State University Northridge's Institute for Community Health and Wellbeing through a grant from the AIDS Healthcare Foundation. And our report is dedicated in the memory of council member and our former president, Bill Rosendahl. I have provided a list of all of the commissioners. I won't read them all, but I just wanted to acknowledge all of the people who worked on the report. We broke up into various work groups in order to compile the information and decide what we thought was the best strategy for presenting the report. The report is utilized using Heinrich Bloom's model of health with a focus on the social determinants of health. And our section headings are divided into 3, which are homelessness, healthy living, and medical services. So our first section, which is homelessness, here, our goal is to reduce barriers to health and housing access. There's approximately 28,464 people who are homeless in the city of Los Angeles. Homelessness can be both a cause and a result of serious health issues. So we have to recognize some people become homeless because of these health issues, and some people become ill due to homelessness. A 2010 study showed that 73% of people who are homeless had at least one unmet health need. The cost savings for moving someone who is chronically homeless and living on the street to housing is $25,000 to $35,000 per person. And this is one of the statistics we were able to use to get SB 1380 passed by the state to put the state on a housing first model, which is all the cost savings. So you not only reduce barriers and create better health outcomes, but it also saves city, county, and state government money by moving people into housing. So the first thing we want to call attention to is the county's Housing for Health program. This is the county's Housing First program. It's for people who are chronically homeless. It is a C3 program, so it's county, city, and community. Currently, the only dollars that are being put into this program are from a discretionary fund from one of the council members. So the city currently is not putting money into this program. However, most of the people that they are serving and moving from the street to housing come from the city of Los Angeles, many of them from Skid Row. Eligibility for this program is that you have to be homeless for a year or more, or 5 times in 4 years, and you have to have utilized a county health facility. This would mean a county hospital or a clinic 3 times in 1 year, and that would make it your medical home. That is a very interesting eligibility because it's a lower threshold for eligibility than the HUD programs. So you can see it's much more flexible. There are 1,761 individuals who have been housed through this program since 2012, and there's a 97% retention rate, which is much higher than we see. There's a 92% retention rate in Utah's Housing First program, and in the county of Los Angeles has a 97% retention rate, which means that people are not leaving the program, they're not leaving their housing for the most part to go back into the street, so they're very stable. One of the unique aspects of the Housing for Health program is that they have a flexible, subsidized housing pool. So typically when we think about helping people access housing, what we think of is getting a Section 8 voucher and then moving them into the Section 8 program. However, there are a lot of barriers with HUD, and some people are not eligible. And so the flexible subsidized housing pool actually helps people who are not eligible through HUD programs, but are still costly to the city, county, and state. And so this is a fantastic model actually for a lot of counties and also the state if they wanted to do this, but also the city. If the city was interested in creating a flexible subsidized housing pool, a lot of people who don't qualify for the HUD programs would qualify for a program like this, and it would save money at the same time for the city. The other unique thing that they do in this program is a master lease program. And in this particular program, a company called Brilliant Corners acts as the sort of tenant with a landlord. So the contractual relationship is between a landlord who owns a building and Brilliant Corners. And Brilliant Corners then has insurance and basically creates a situation where the person who's given the unit, who is moving from homelessness, has wraparound services, so it's permanent supportive housing, and then they also guarantee to the landlord that the unit would be returned with just reasonable wear and tear. So it's a great relationship. It doesn't create barriers, and for someone who is homeless who may not have good credit, the landlord may not want to move someone who's homeless into that unit because they might feel there's a risk there, which may be unfounded, but they still may think that there's a risk. And so when they know that they're contracting with Brilliant Corners, it actually creates a great and unique relationship. So that's one of the things that we were looking at. Because the normal way that we do things now, there are so many barriers with credit reports and just even someone and how they would present themselves to a future landlord. So our recommendations are that the City of Los Angeles explore ways to expand the Housing for Health program through financial and community support, through education, just any way that we can get the word out about this program, and maybe put funding in, because the more people that we house through this program, again, the more cost savings we're going to see. And then to explore the implementation of a flexible subsidized housing pool for chronic homeless populations in Los Angeles. So we can create our own flexible subsidized housing pool and our own program similar to this if we feel that we don't want to, provide any kind of financial assistance to the county program. Although I have to say, I think the county program is working fairly well. So here are other ways to that we thought of reducing housing barriers. One would be to expand access to homeless housing. So there's affordable housing, which is not necessarily for people who are homeless. As I explained before, some landlords are reluctant to rent out to folks who are homeless, and so we need a specific group of housing that's homeless housing, which of course leads into the Prop HHH and a lot of what we've been talking about in the county and city. Prevent affordable housing developers receiving funds from the city from excluding individuals experiencing homelessness in the application process. So one of the things that we've seen sort of out in the field is that there are developers who come for city dollars to create affordable housing, and they actually exclude people who are homeless. And not just people who are homeless, but people who have been homeless within the past 36 months. And what they do is they create applications that state that you have to have 36 months of permanent rental history in order to rent the unit. And that means that not only can you not be homeless at the current time, but you can't have been homeless in the past 3 years. So if we can, if a developer is coming for city dollars, if we can specify that they can't discriminate against someone who is homeless or had been homeless in the past 36 months, we think that it would help to reduce some of the barriers for the money that we're giving for affordable housing. Also, one of our recommendations is to reduce barriers for families and individuals obtaining services from nonprofits administering homeless set-aside Section 8 vouchers. Sometimes it's very hard for families to go through the process of even getting into a shelter. There are some shelters in the city that require birth certificates for all the children, and so they have to go to Norwalk to get them. They have to have TB tests, which can be costly. So there are a number of barriers that some shelters that have the homeless set-aside vouchers have just getting families into these shelters. So that's one of the things that we might want to look at, since the city gives dollars to the nonprofits, is just saying, what is an easy way for people to get in and then move from an emergency shelter to transitional housing in a way that doesn't create more barriers for them. And what we want to avoid is them either going away in frustration, staying on the street, which isn't good for anyone and doesn't create good outcomes. But we also want to make sure that they don't get into the program and then have barriers within the program that forces them to leave. And that makes them sometimes even more resistant to services. And then lastly is to preserve rent-stabilized housing to prevent homelessness. So the next thing we'd like to talk about are sobering centers. So a sobering center is a supportive environment for publicly intoxicated individuals. In Skid Row, it's an average of 30 calls per day, just for people who are chronically intoxicated. And there's been an 18% increase between 2014 and 2015, which is attributed probably to the rise in homelessness in the city. These sobering centers connect chronically inebriated individuals to services. So it's better, usually, rather than to have police officers come and take someone away or even to an ER, to move them into a sobering center where then they can get sober, and then a caseworker could talk to them about moving into an alcohol rehab program, or connecting them to any number of services. And it's just a better environment and a better outcome for most people. So there is one that the county has opened, which is next to Star Apartments. So it's in a really good location. I've been to the Star Apartments, the Housing for Health office, and while I was there, the fire truck came down 3 times. So it's a way to reduce the costs of, from the fire department having to come out all the time, and it also allows the caseworker to connect with people. So it's we think it's a pretty effective way to deal with this issue. It also decreases the number of ambulance trips to emergency departments. It reduces costs for paramedics, which is about $1,750. They have to come out, and EMTs, which is the cost of about $850. So our recommendation is to increase the number of sobering centers, which could be administered, obviously, by the county, or you could create a dual county city sobering center, whatever that permutation is or looks like. We just feel that it not only saves money, but it gives a better outcome to people who are chronically inebriated. So this is a photo of Skid Row. One of the issues going on there, obviously, is that there are not enough trash cans, and so it is literally overflowing with trash. The last time I was out there, there was actually a water bird. It was picking through the trash. So one of the issues, too, at night is that rats come out and they're just scurrying all over and they're eating from the trash. So that's something that, for public health reasons, should be addressed by the city in some way. Maybe the mayor's office. I'm not sure, what the bureaucracy is there, but that needs to be addressed in some way. So bathrooms. The World Health Organization recommends a total of 1 toilet per 25 users to maintain a sanitary environment. Just Skid Row, and a lot of times we use Skid Row, but we're really talking about other areas that have high concentrations of homeless individuals. It's just that we have statistics for Skid Row, and since it's a high concentration, we can use that for the statistics. But I don't want to leave the impression that we're just talking about Skid Row. But Skid Row represents the largest homeless population with 8,000 to 10,000 people who are homeless in the downtown area. In 2012, the Department of Public Health found the city in violation of county health codes after 90 pounds of human waste was found in a 10-block radius. And that's due to a lack of toilets that are accessible. So these conditions are linked to outbreaks of staph infections, meningitis, and tuberculosis. So based on WHO's recommendations, there should be about 400 toilets available on Skid Row with 24-hour access, and currently there are 5. So if we can start moving toward a number that makes more sense, it doesn't necessarily have to be 400, but if we can start increasing that number, it would be great. And I've been out there several times when the bathrooms have been broken. There's one public toilet that's outside at the corner of, or near the corner of 6th and San Pedro, and every once in a while the door is broken or something's going on with that. So more would be better for the whole city. So potable water and food assistance. So we are recommending, obviously, increasing hydration stations. This would be throughout the city. A lot of parks used to have water fountains, and they've taken them out. So when I was a kid, I would go to the park, and there would be water fountains, and they were taken out for various reasons. And so that has left a lot of people without access to water. So anything we can do to sort of increase these hydration stations would be great. Also increasing the number of times an individual can access any given food pantry. So the way the food pantries work now, some of them limit people who are homeless, or not even homeless, but just in need of food, to once per month. And so what we're seeing is that if someone maybe starts in Koreatown, let's say at Emmanuel Presbyterian Church, and then they're making their way like every week or every 3 to 4 days to another pantry that's farther and farther away from their home, toward Echo Park, while someone from Echo Park is making their way toward Koreatown. So we want to stop them having to travel, and it's usually, so if they're on CalFresh, they're usually out of those benefits within 2 weeks because those benefits are so low. And so we find that when they need money the most and when they're out of food, they also have to pick up transportation costs to make it farther and farther to food pantries. So even just convening a meeting where we can talk to people who are running these food pantries to sort of try to get them together.
The food pantries are, it's not run by the city, it's just individually non-profit.
Right, it's individually, but it is creating a problem because if somebody is on public assistance, they're using that public assistance for travel as opposed to helping themselves in some other way. And they may be getting city dollars, and not some of them probably are. And then another suggestion is to appeal to the county to increase general relief at a level to sustain life. So currently general relief has been sort of stuck at $221 for decades. And it's not enough, clearly. That's just for people who are not on disability and have to live on $221 plus CalFresh benefits. It just is not sustainable. So that's something that needs to be discussed. I mean, even if there's another barrier that this creates too, which is that a lot of times Section 8 vouchers are given to people who make or bring in at least $815 a month. And so if you're on general relief, sometimes you are skipped over for housing vouchers because they don't think you'll be able to pay for utilities and other things to keep up your apartment or your unit. The other is to lobby federal and state governments to increase CalFresh and SNAP benefits. Mainly that's the federal government, so we're in a situation now where we're looking probably at cuts to those programs, given the Speaker of the House and our current president. And then the other is to increase healthy food options in shelters. So there are people who have food restrictions, particularly diabetics who should not be eating starchy foods, and a lot of times that's what they're served in shelters. And then that's coupled with the fact that they can't bring food in from outside, so it's creating a problem where they either eat the food at the shelter and end up getting sick sometimes because it's not food that they should be eating. And so just increasing fruits and vegetables, and that's something the city, since the city does give money to most of the shelters in the city, that's something where we can have a conversation with them about that. Because if they do end up in the hospital or something happens, it tends to be a cost to the city or the county. Okay. So for health access, discharge planning, and transportation, one of the things that we've found, so this would be coupling back to the Housing for Health program. And I mentioned that part of the eligibility is that you have to have gone to a county hospital or clinic at least 3 times in a month. I mean, not in a month, in a year. So they're actually very hard sometimes to get to if you don't have transportation. So one of the doctors who came and spoke to us recommended that the city or the county, or maybe jointly both, support a shuttle system to the county hospitals and clinics. And then even that shuttle system could extend for discharge planning, getting someone from the hospital to a rehab center or transitional housing or wherever they're being discharged to. Currently, our county hospitals are not supposed to be discharging out to the street. So one of the cardiologist who spoke to us from one of the county hospitals said that they have people who have been there for an entire year just waiting to be discharged because they had nowhere to discharge them to. Also in transportation, we'd like to expand transportation vouchers, expand access to consultants and other medical providers in areas with large homeless populations. So we found, we did have some medical providers from Skid Row speak to us. I think they were all nurse practitioners, but they were saying that there's a dearth of consultants there on Skid Row. So if they're referred out to a consultant, a cardiologist, a gynecologist, they tend to need transportation in order to get there. And then there was an additional barrier for mothers with children and getting some type of transportation for them, or finding childcare, because a lot of the medical health providers do not allow children into the offices. So it's very difficult for any parent, I suppose, with children to be able to visit a doctor under those circumstances. And then we're also recommending that more shelters provide 24-hour access to their shelter. A lot of times during the daytime they have to leave, and this creates a problem for people who have medications that need to be refrigerated and that they need to take during the day. So that, and also if there's, if they have a medical problem or if they're just getting out of surgery, they need to rest during the day, and so it makes it difficult. I would probably add in there not doing chores. I think most shelters require people there to do chores, and I know that's created a problem for folks who are like just getting out of surgery or have medical problems that prevent them from doing that, and there's a feeling that they still need to do it. And then discharge from hospital to housing, just making sure that caseworkers are following folks who are leaving county hospitals or clinics that are homeless and discharged to housing, just to make sure that they get there and that they understand when their follow-up visits are and that kind of thing. So just more case management is what we were seeing. So next, I'd like to talk about heroin and other opioids. So there are 5,000 to 7,000 active heroin users among the homeless population right now in the city. And the drug Narcan, which is an opioid antagonist, was responsible for 10,000 overdose reversals nationwide and 1,000 in Los Angeles. So our recommendation is that the city subsidize and provide widespread availability of Narcan to first responders and government and nonprofit workers, since it saves lives. And it's being used all over the country, and it's actually very easy to administer. And it was relatively inexpensive. I think it was like $1 for, one of the vials in the shot. And the pharmaceutical company recently had it go up to $10. So it won't be quite as affordable. Our second section is on healthy living. The objectives here are to lessen alcohol and tobacco abuse, reduce diabetes and prediabetes, prevent infectious disease transmission, and ensure health equity by reducing population-level economic, racial, and social disparities. So our actions related to that are to accelerate progress to achieve the objectives in a plan for a healthy LA, which is a wonderful plan. We just feel like a lot of, if we could move the implementation along, that would be great, and the county's health improvement plan. We'd like to accelerate progress on actions proposed by community stakeholders during Health Commission meetings. So we're going to try to find a way to expedite their proposals with bringing that to council or bringing it to this committee, and then build on the strong relationships between city departments and county public health and mental health departments. So this part of the section is the plan for a healthy LA and the LA County Improvement Plan. So we want to determine the extent of progress toward the objectives in each plan. Again, a great plan, but we need to do an assessment of what's being implemented and what isn't, and then to identify the obstacles for plan recommendations that have not moved forward. And the Health Commission can facilitate a discussion with LAUSD to support the creation of healthy kid zones. And if you're not familiar with the Plan for Healthy LA, some of the vision statements that's part of that is to complete neighborhoods that meet residents' basic needs, including access to health-promoting goods and services, which include affordable grocery stores, comprehensive medical services for both physical and mental health, park space, and childcare. And it's much more comprehensive than that, but for the sake of brevity, I'm just highlighting those. So next, we want to talk about community stakeholders. So we want to improve access to affordable, nutritious foods and proximity to park spaces. All city departments, we're asking to implement good food purchasing policies, to focus on healthy food incentive zones to close food access disparities, to increase breastfeeding at workplaces, starting with city departments, to implement the Quimby Park Free Ordinance to increase resources to park poor residents, and to ensure adequate funding and full implementation of the City of LA's Vision Zero program to improve safety for walking and biking, therefore obviously increasing health and exercise. Okay, so our third section is on the LA Fire Department Emergency Medical Services calls, and this is under our medical services section. So in 2011, we spent $2.4 million on super user incidents, and only $231,000 was paid for or reimbursed by insurance companies or by the individuals. Although usually not by individuals. So the super users represent serial inebriates, which we talked about during the section on sobering centers, and people with chronic illnesses that repeatedly call 911. So these are typically folks who are either, as we said, serial inebriates, or sometimes people who are not getting the proper preventative care, so they're having strokes or heart attacks, or have these chronic problems where they're constantly calling 911. So our recommendations for this section are to elevate the importance of medical services over policing EMS calls, to transfer serial inebriates to sobering centers, as we talked about earlier, and to expand the SMART crisis response team within the LA Police Department. And this would be to take some of the stress off of the LA Fire Department. There are just so many calls that they're getting, and they're from the same users. And so we want to free them up to be able to take on other emergencies. One of our recommendations is to increase the use of fast response vehicles. So fast response vehicles are like these pickup-sized trucks that are staffed with 2 paramedics on patrol, located in busy EMS demand areas. And it allows for quicker response time and faster care pending the arrival of an ambulance, so they can get there much quicker, and they have smaller vehicles, which helps them sort of navigate through the city. And so our recommendations would be to provide more FRVs, establish a hospital agreement to transport to the nearest hospital with these FRVs, so they can actually transport, and then to reduce the wall time response referrals to minimize the gaps in lapse time in which paramedics and EMTs cannot leave an emergency situation until a patient is transferred. So a lot of times they're just waiting and idling for a while until they know where the patient can be transferred, and it ties up several paramedics and that could be responding to other calls. So our next slide is the expansion of response unit programs. This is sort of similar. There's sort of a theme here. So this is to implement and expand the nurse practitioner response unit and dispatch programs, whereby a paramedic and nurse practitioner respond to calls and try to treat and release the patient and arrange for more appropriate source of medical care. So that's for folks who are not like highly acute cases where you could just assess the situation. It might be a serial inebriate in need of a sobering center, and then you could move them quickly to care. And that same thing with the practitioner at dispatch program. So these would be for very low acuity cases where people call in and say, I think this is what's going on with me. And in some of those cases, a nurse practitioner may be able to refer someone immediately to a place if they can get there, as opposed to having to wait to send a team out. But again, that would be for low acuity cases. And both of these programs are actually in the pilot phase. So we're waiting to see sort of what the outcome is there. And then continue the development, expansion, and implementation of the sobriety emergency response unit, which is very similar, but again, you can see they're being compartmentalized. And sort of a smarter way to respond. And then to continue the development and expansion of the mobile mental health unit. So we did see, obviously, that Zika virus there was an outbreak, and since 2015, there have been 472 travel-related cases of Zika, 106 in the county of Los Angeles. And in California, we had 73 pregnant women who were infected and 3 children born with birth defects, which is microcephaly for the most part. So our recommendations really are to enhance outreach at airports. So one of the things, there were some people that I knew who were going to Rio because, we were moving to get the Olympics. So they were going out there, and I had them looking for any kind of information on Zika virus, and they really couldn't find any. And so we did talk to the airport, and they said that there was a sign somewhere, but they couldn't identify where. As opposed to New York, which has right there in their kiosks these huge signs about Zika virus, educating on safe sex practices for people coming back so that they're not infecting a partner. And so we think doing that outreach at airports for people traveling to countries or areas, like we saw in Florida, there was an outbreak. So if they're traveling into those areas or coming back from them, they should be educated on how they can protect their partner. And then increasing the frequency of messages on kiosk screens. So if it's something that's toggling between different messages, to increase that, increasing awareness of safe sex practices, and the need for that. Because I think that a lot of people traveling to these countries may not know that they need to engage in safe sex for at least, I think, a month or two. So, and then include alerts on itinerary or tickets. So a lot of the things that we have now are electronic, so it's easy to put a little alert saying you're traveling to Rio. These are some things that you may need to know. And then including text message alerts as part of emergency alert systems. So if we know that there's an outbreak and people are traveling, that we can sort of educate them. So we also saw an outbreak in meningitis. And for the county, we're recommending that they do a more thorough job in terms of particularly reaching out to subpopulations. So since 2013, there have been 2 outbreaks of meningitis leading to deaths of 2 men in 2014, and then 2 deaths out of 27 cases in the 2016 outbreak. And this was as of August of 2016, so there may be more at this point. In each case, it was the LGBT community that was disproportionately represented. So we'd like to find a way where when we know there's even like 1 or 2 cases that we're immediately creating awareness among subpopulations that are impacted. Part of that could be utilizing like LA Pride and similar festivals if it's prevalent in that particular population. Also developing a community plan for immediate access to vaccines so that people can protect themselves as quickly as possible. Utilize social media networks like Twitter, Tinder, and Grindr. So some of the issues are finding, like if there is an outbreak of meningitis and somebody has bacterial infection, to make sure that we can identify or contact people that they may have had sexual relations with. And sometimes we want to make sure that we're sending out these alerts, through Tinder or Grindr or Twitter or anywhere, just to make sure that people are aware of what's going on. And then to initiate collaboration between the county and city to roll out an education plan, outbreak alerts, and emergency response. So it's basically saying the city and county should share in making sure that people are aware of what's happening in the community, particularly to the subpopulations, because if it's sort of running through a particular subpopulation, you want to make sure that people are aware of it, particularly if there are big festivals coming up like Pride. So that is it for our report.
Thank you. That was a lot. That was a lot. And, I have a couple of, there's a couple of things in here that we could work on immediately, and my office would love to work with you on it. I want to hear from the CLA as well, CLA and the CAO on some of the implementation. But I think some things like, where is it? The good food purchasing policy for all the departments as well as in our shelters that are funded. To increase healthy food options. I think that's something we could work on, and we probably have to talk with housing committee as well. Also, something with the food pantry. See if we could get that started. I think that's a great one. I think the one for the Zika virus, especially at LAX. I mean, that's kind of embarrassing if LAX could even point out to you where the sign was. But I think, simple things like that, we could work on that. A couple of questions I had for you was, does the commission have any representation on Measure H or HHH?
What do you mean by representation?
I know there's like a whole stakeholder process going on, especially for Measure H. It's about, 150 people involved?
We don't, but that would be great if we could connect and be part of that.
Okay. Because I asked that because a lot of the things, especially for the homeless front, is all within county jurisdiction. And I think Mitch Katz is doing a wonderful job, especially with the Housing for Health programs. I mean, he's expanded the definition of what health means. So they're actually funding a lot of this. And I know we have HHH, but HHH is pretty restrictive. It's actually for the building of it.
Right.
But Measure H is a godsend.
Right.
So, and a lot of the things you point out is what Measure H could fund. And having worked in the homeless arena, I mean, I know how hard it is to get funding, and everything is so underfunded. But but the county has, not just the Housing for Health dollars and flexible housing subsidy pools, but they also have full service partnership dollars. I mean, they have whatever it takes, monies to fund everything. So that's one area. We'll see. I mean, we'll see if it's still possible for you to get on Measure H somehow. And have you, I really highly recommend, and of course in hindsight, maybe we should have done a dual presentation with the Homeless Committee, but obviously we didn't. You should really talk to, try to get a meeting or maybe have your commissioner for Councilman Gil Cedillo for a lot of these housing issues. Councilman Mitch Englander, who was going to come today, but he had a last-minute emergency today, who sits on public safety, especially for not just the homeless portion, but then also the emergency management, because public safety, that's an issue that they've been talking about, especially with nurse practitioners and all these other issues that you brought up. So I think they would be lead. And who else? I think talking to Councilman who appointed you regarding the bathrooms, especially in Skid Row, and I would love to do something with them. I don't want to. I mean, it was so comprehensive that you could probably spend the next year just briefing everyone. Yeah, if you could, I highly encourage you to. Maybe not just presentation in their respective committees, but actually just going to the chairs of each committee and discussing these issues and see what ideas, because I know a lot of the things you brought up in your report we're already working on. One other piece I'd like to point out is is in Section 2, Healthy Living. Really love to, we're doing a lot of the things, like especially talking with LAUSD about the healthy kid zones. But as you know, our workers' compensation claims in the city of LA were about $150 million. In the next couple of years, we're expected to double that. And we don't even have a wellness program like the county does. And I know you alluded to it here. We would really like your assistance on creating more of a robust, I mean, this is a mayor's top priority, as well as a priority in this committee, about having healthy, at the very minimum, a wellness program, right? The fact that we don't even have that, because it's literally another about $150 million of workers' compensation that we're seeing, that if we could stem the tide of that, that's another $100 million we could free up to actually fund a lot of these other services.
Yeah, so we had someone come and present to us last month on this.
Great.
Was it last month? It was last month or the month
It
before?
was the same person that presented it,
Yeah,
Schmel Graham.
Same
Yes.
one who was here. So, yeah, so we're on that. We're
Right.
looking at that.
And we're looking at that as well in this committee, but that's something we'd love to partner with you on. I'd love to partner with you on everything, but I'd love to hear the next item. But so we will receive and file and send it to committee.
And Ron, did you want to say
anything else you want to add, Ron?
Well, just one thing, the city put time into creating the plan for a healthy LA. That's the plan. It'd be good if, we could always come back to that, after the implementation to see where we're going to go forward. Otherwise, we could be going in different directions and that plan could be sitting aside someplace, right?
Right.
But I think if that's the blueprint, then I think if we could work with that, then it'd be easier to measure and see results and see where we have to tweak to go to the next phase. So that would be my recommendation. If we can put that plan for Healthy LA up, out
Yes.
more, that'd be it.
Definitely. And that is going to be a priority for us. So, and we love to partner with you on that. Everything you brought up are important items, but we have to be mindful of our budget as well, right? We want to, and the fact that we have such a great collaboration with the county, and the fact that Measure H passed, because I was happy about HHH, but I was concerned because just building some extra housing isn't going to cut it. Right. So now that we have H to complement with services, so while we want to expand and create our own programs, we have to focus on what we do best here. So, but I'm open to ideas and suggestions. But we'll continue to talk, and thank you very much for this comprehensive report.
And we're also, I know this is a budget committee item, but we are also looking for some type of funding for the commission.
And actually, and that's another Councilmember Krikorian you should go talk to. Obviously for this budget cycle, it won't be probably not included, but you want to start the discussion now so we could use the coming year to see what cost savings we have and what other areas we could put into. And that's why it's important that we'll try to see if we get your representation in Measure H and HHH as well.
Okay, great. Thank you.
Thank you. So we will receive and file that and move it on to council. There's no public comment, right? No public comment. On this one? Great. So item number 2, Mr. CLA.
Item number 2 is motion Rue Harris Dawson relative to instructing the city administrative officer to report within 90 days on the feasibility costs and timeline for implementing the recommendations contained within the 2015-16 Los Angeles City Health Commission annual report.
Great. If we could have the CAO come on up. This is the motion that I introduced in council to instruct the CAO to dive into the recommendations listed in the Health Commission annual report we just heard about. And if you could, I know it's a lot, so, and we could, it'll probably take the entire city budget to do everything we wanted to do here. But if you had an opportunity to determine the feasibility and the timeline about some of these and the report.
Absolutely. Melissa Fleming with the CAO. As you mentioned, there's quite a variety of items included in this report, and they sort of go through a wide breadth of different services that the city provides. As you mentioned, some of these items are already in progress, and as the commission mentioned as well, a number of the fire department items as far as the sober unit, fast response vehicles, our NPRU, a lot of those items are currently going through the budget process right now and looking at how we can continue and or expand a number of those items. Some of the other items, as we discussed, involve some coordination between the city and the counties, so those are some other items that perhaps we can get a start on right now that might have a little bit easier go forward because they may not have a significant budget impact. But as you mentioned, we'll be happy to go through all the recommendations in this report and kind of come back with a detailed list of what are things we might have the funding and capacity to start right now, and what might be things we need a little more time, and what might be things that we can, as you mentioned, might be able to help advocate for inclusion in things such as Measure H funding.
Great. I'll really looking forward to the report, and if you could work with my office. And I pointed out a couple of things that I think we could probably do immediately, but if you find some additional things that we could possibly introduce a motion so we could get the ball rolling, I'd really love to kick off the first report that the Health Commission did with some sort of results, action steps that at least for the simple low-hanging fruit one, like the LAX one. I think that one costs too much, right? So if you could help work with my office and work with the Health Commission, and I know they didn't do the full report for time's sake, but if we could have a conversation, actually, Mr. CLA, I'd like to amend the motion if we could add CLA to this, not just the CAO.
Okay.
And we'll take it and move it along to City Council. Thank you.
Perfect. Thank you.
So item number 3.
Item number 3 is a CAO report relative to a child savings account program in the City of Los Angeles, for City Los Angeles Unified School District students. This item was continued from the December 12th, 2016 committee hearing.
Good morning.
Great.
Aurora Brasio with the CAO's office. Before you is a report from our office that was prepared in response to a motion with the assistance of the CLA and the City Attorney's Office related to the feasibility of creating a child savings account program within the city. We were asked to review other jurisdictions implementing a CSA program, as well as the possibility of request for information to have interested participants help the city create that structure. On December 12th, 2016, our office presented a verbal report that covered many of these issues, and if you'd like, I can provide a highlight of those. If not, essentially we did cover eligibility, different types of accounts, and the funding impact. We noted in our report that, in our written report, that this would have a potential for impacting the general fund should the city go forward. And we acknowledge in our recommendations that it should be considered as part of the city's budget process. So this, as well as other priorities, could be considered equally. But given that this is a policy decision for the council, we also include in our report a recommendation for the Department of Housing, Community and Investment Department to release a request for proposals for consultants should funding be identified for that purpose. And I know the department is here if there are any questions.
Right. Yeah. No, I'm very excited about that. We finally got the written report back, and we can move forward. Do we have a representative from? Do you want to add anything?
Good morning, Councilman. Abigail Marquez, Assistant General Manager with the Housing and Community Investment Department. Our department also issued a report back at the request of the Chair of Budget and Finance. The funding has not yet been identified for us to be able to bring on a consultant, but we are, of course, available to work with you and your staff or anyone else that you designate to explore other funding opportunities. We do need a consultant. We don't have not only the staff capacity, but the expertise. I am familiar with the evolution of the CSA programs, but, I would need some additional staff support to be able to execute, a well thought out proposal for you to consider in terms of how to phase out this type of program citywide.
So what do you envision the key aspects of the consultant's work would be?
The key aspects are, some of them are identified in the report, but we would envision that the consultant would help us with, the initial phases of this work, the funding structure, the responsibilities of all of the partner entities, from working a lot more closely with LAUSD to really understand what their commitment, what they're going to be doing to be able to shepherd this work, along with, the county's involvement, since LAUSD is not just within the city boundary, but there is a role for the county to also play. Does it make sense for it to be, where should it sit more long term? Those types of things I think we would need a consultant to help us figure out.
Great. And quick question for the CAO. I mean, great report, by the way. But how much time would it take to hire a consultant?
That would be something we'd have to coordinate with the department in terms of developing the scope of work, and then once it's developed in consultation with the council offices, then it would need some time. I don't know if it could be several months before we would actually have a request for proposal.
Right. We would need to work on issuing the request for proposal. We do have, hate to say this, but it is our reality in terms of the staff support in our procurement unit. So there are other already RFPs that are in the pipeline that we would need to issue. We have a very small procurement team that would work on that. I would work with them to issue an RFP. Once the RFP is out, it does take, at least a couple of months to have the RFP out so that there's a well-qualified pool of responses. We have to then review them, and there's usually an appeals process, et cetera. So it could be anywhere from 3 to 6 months.
So 3 to 6 months
relatively
to hire, or 3 to 6 months to get the RFP out?
I would say to issue the RFP. Yeah.
So 3 to 6 months to issue, and then how long to hire, you think? With potential appeals and all that.
Yeah, that's also the shortest could be a 3-month process.
3 months.
Yeah, and I'm just giving you ballpark.
Right.
We would have to go back and assess again which RFPs are currently in the pipeline that we do need to issue based on other priorities or funding commitments.
And let's say we do it in record speed and get a consultant hired in 6 months with all of this. So how much time do you think the consultant will need to complete the study? I know obviously we don't have the scope of work yet, but...
Right. I know that there is an interest to launch in the fall of next year, so we could work with your office to work from that date, backwards from that date, and maybe it's the initial phase 1 of the project, but we can work with your office to be able to meet that.
So you answered my question, so I guess we would be able to.
I mean, that's your goal, that is your goal, and we're clear that that is your goal. We would do everything to ensure that, we can meet that, and we would communicate with you if there are some challenges along the way.
Yeah. No, I mean, everywhere I go, every time I even mention this, everyone is interested in this, and obviously, we will be the first large city to implement such a program, but it's proven it works. So everyone I talk to wants to partner. So I'm very excited about this. We want to make sure we don't lose steam and we move forward on this and make this this is a high priority for my office and this committee. But anything else you want to add?
No.
Okay. There's no public comment on this, but I do have one technical amendment. For recommendation number 1, before we move it forward, I recommend that we strike the words "submit a fiscal year 2017-2018 budget request for funds" in the first sentence and replace it with the words "review funding opportunities available." Okay, so, and we will be reviewing, and there's lots of opportunities. So, thank you.
Thank you.
Thank you, Mr. CLA, and we'll push those 3 reports on to the council as the chair's report, and seeing no other public comment, thank you so much. We ran a very efficient meeting. Thank you. Meeting adjourned.